a real pleasure to be able to speak to you. My name is Ed Fitzgerald. As been introduced, I'm a Global Health Executive for KPMG's healthcare practice. I actually started my career as a physician. I was a surgeon and worked in the National Health Service for 12 years prior to joining KPMG. And I now specialise in healthcare, looking more at the systems and provider side. Thank you. So just by way of brief introduction and background, I think many people still see KPMG as a traditional company providing audit services. And actually it may come as a surprise to many to hear that healthcare is now offered through 45 of our practices globally. We have over 4,500 staff who provide expertise in healthcare right around the world. Briefly, this covers main proposition areas across 6 key areas that pose challenges and trends to many of our clients that we work with. And uniquely, we're able to draw from right across the teams working in these areas to help build universal health coverage through our new Centre of Excellence, which is specialised in this area. We'll say more about that in a minute, as that's a real theme of this conference we've been talking about. We've developed considerable expertise in the 8 years that our global healthcare practice has been running. We've become a real authoritative voice across a number of the key areas where health systems and clients we work with are facing challenges and issues. These are some of our recent publications that are available from our website. One of these isn't listed there, and that's what I'd like to talk to you for a few minutes about to start this session. That's our most recent publication, Through the Looking Glass, which is looking specifically at health system transparency, an area that many are still afraid of, that they see as a real challenge. We've investigated this area with a novel piece of work that I'd like to share with you today. We've set out to examine 32 of the world's healthcare systems, and we've set out with a hypothesis that health system transparency is a real benefit, it's a real positive change for health systems if you can utilise it in the right way. We set out to create a new global healthcare transparency index investigating these 32 healthcare systems against 6 key dimensions that are listed on the screen here. In total, we looked at 27 key indicators: quality of healthcare, patient experience, finance, governance, healthcare data, and communication of that healthcare data. And we looked at whether this could be used as a powerful agent to improve efficiency and decrease costs. That was the hypothesis that we set out with. The novel findings from this work showed that actually if you look globally, no one health system is particularly good at utilising healthcare transparency in the right way to achieve that force for good that it can be when it's well used. No health system is pursuing it in a truly strategic way. And we've pulled out some key learning points that I'll share with you in a minute. The average transparency score globally for health systems by country is only 55%. You can see on the map here that some of the highest performers were the Nordic countries, which have traditionally had an excellent record in sharing healthcare data from their healthcare systems. Some of the lowest performing areas with room for improvement were right around us here in Southeast Asia. But that's not quite the full story, because when we look at the different dimensions that we considered in detail, you can see here that actually globally there's quite a disparity between reporting within the different areas. As I say, no one particular area is outstanding at this, but certainly you can see that finance and governance tends to be more, data tends to be more freely available. But actually I would argue from a patient perspective that 2 of the most important attributes are actually very poorly reported globally: quality of healthcare and patient experience, which are 2 really important themes that we've been talking about at the conference today. Actually, availability of that data for patients to use, for health systems to use, is remarkably poor at a global level. We identified some common practices of those countries that scored highly and some of those that didn't. We found that in the highest scoring countries, typically they would have patient data privacy laws, particularly around safeguarding policies for patient data. They had policies and laws in place that already outlined what patient rights were for the availability and sharing of healthcare data. And most of these countries also had existing freedom of information laws enabling and facilitating access to that data. For the countries that typically didn't score so well and weren't so able to facilitate transparent healthcare data, some of the attributes that were most commonly found were the difficulty in tracking down payments, gifts, hospitality received, so a real lack of transparency around disclosure. These countries typically weren't sharing clinical documents with patients, and patient-reported outcomes and approval ratings were very unclear, if available at all. So some of the lessons that we've pulled out of this to share, which we think are particularly important ways in which countries can start to take a strategic whole system approach to the sharing of healthcare data, and through that potentially realising the potential that's available to increase efficiency and reduce costs, are listed here. One of the most important features is that a country should take a clear strategy to the approach on this. Just blanket reporting of all data available without any particular target, means or aim to this doesn't actually assist the healthcare system at all. There are many examples of innovative providers who are already looking at this, taking data and using it either themselves or making it available to independent organisations who are able to put together ratings and to provide other external assessments of healthcare organisations and systems. And we have copies of the report for you which detail that, and we'll be able to distribute those at the end of this session. I would encourage you to read that to see and learn from some of those innovative providers. To pick out one or two other points, I think it's very important to measure what matters to patients. The patient should remain central at this. Reporting of esoteric data around governance or finance, for example, doesn't necessarily help the system improve the quality of what matters to patients, their experiences and their outcomes. And very importantly, all of this needs to be structured within a wider approach to safeguarding patient data within that country, be that at a national legislative level or at a more independent level as to what is individually shared with patients and made available to them. Now, one of the other key themes around this conference we've been discussing so far, and I mentioned earlier, is around universal health coverage. And KPMG has been very fortunate to be able to take some of our learnings from health system transparency and actually put those into action. We've recently completed implementing universal health coverage for a country in the Caribbean, and we've actually been able to benefit greatly from looking at the practical application of that within this country setting. As I mentioned earlier, we have a new Centre for Universal Health Coverage which brings together all of the different expertise under the umbrella from KPMG to be able to look at how a whole health system can be improved and implemented. One of the points that I haven't heard mentioned so far today, which I think is just important to flag, is helping a lot of countries, a lot of governments understand that universal health coverage is not just a cost, but it's a real value. And one of the areas that our teams have been working with many countries that are looking to implement universal health coverage is providing some transparency in what that benefit can mean to the nation as a whole. This is a report that we undertook in the Caribbean, demonstrating that by 2030 for the country in question, they were looking at a 2.7% increase in overall GDP for the nation based on the implementation of universal health coverage. And providing that sort of transparency in economic modelling and data to the country has been a really powerful force in ensuring that the ministry went ahead and implemented universal health coverage for their population. One of the problems that has been spoken about a little bit already today is around how's that financed? How are we actually able to provide nations with the financial capacity and organisation to implement such a massive project as universal health coverage? And this is where private organisations can play a really important role right across the spectrum of how that is implemented, from health service delivery through to the financing, through to the management and communications, and through to stakeholder engagement. And that's an area where KPMG has been using the new Universal Health Coverage Centre of Excellence to bring all of those different threads together and provide that facilitating expertise to ensure that happens. My colleague is going to now talk a little bit more in detail around private partnerships in healthcare, and I'll hand over to